Hello everybody, my name is John Blanchard. I'm a family physician here in Michigan with SALTA Direct Primary Care, and I am living in a camper. I never thought I'd have a camper, but I got one because I wanted to get separation from my family during this crisis, during this viral outbreak, because I wanted to keep them safe. And I thought that during this time there's a lot of misinformation out there, there's a lot of wrong information out there, and I thought it'd be a good idea to do videos, short little videos, to get some good information out there that's based on fact. And I'm going to do one of these videos each night while I'm here living in the camper. Today is March 23rd, this is day one in the camper, and I'm using the CDC as the single point of truth for these talks. So the information is coming from the CDC, sometimes also directly from Beaumont Hospital and their advisories, or the University of Michigan. I'm just trying to get good information out for people here in the state of Michigan. When I do these videos, I'm going to cover 3 questions that I'm commonly getting, and if you have questions, you can visit us at facebook.com/SALTA of Clarkston, Direct Primary Care, or facebook.com SALTA of Troy. And you can submit questions there, and I'll answer them, and or answer questions that I get throughout the day in my daily work. So one of the main questions I'm getting is, what is coronavirus? So coronavirus is the common cold, and it's very contagious like the common cold, but what happened is it mutated, and so that instead of like the common cold causing symptoms in the upper airways, this virus causes symptoms in the lower airways often, because it can more readily attach to receptors in the lower lungs. And another question that I get very commonly is, is this serious, or is it just the flu, or it's not as serious as the flu? The answer is it's more serious than the flu. This is a very serious virus. It's one to not take lightly. That's why we have all these changes happening. Today the governor shut down all non-essential businesses. But one of the things that I want to make sure that everybody understands is that in as much as 80% of people who get this virus, you'll have symptoms of like a cold, and you're not going to get really sick. Some people, even young children, even don't have symptoms at all. The problem is that 20% do have more significant symptoms, and some of those end up in the hospital or have a really difficult time breathing. And this is what's scary for doctors, because we haven't seen a virus that causes this many people have this many problems with breathing all at once. And it is affecting people that are even younger, under 50, and not don't have a lot of medical problems. But it's a smaller percentage. The majority of people that have a serious problem with this virus are ones that are older. They're going to be older than 50, and especially older than 80. The older you get, the higher the risk is, and that's why we're really trying to keep our older folks in the community safe, and trying to stay indoors and stay away from each other, so that we can prevent the spread of this virus and bend the curve so that we don't have so many people going into the hospital at one time, and we can better take care of people as they come in. I'm on staff at Beaumont Hospital, and there are increasing numbers of folks going to the hospital with this and experiencing difficulties with breathing, and but I think the healthcare community is rallying and doing a great job at helping people during this time. You might be asking, well, I have a fever and my doctor said that I don't need to be tested. That's true. We're only testing people who have high risk from things like having diabetes or lung disease or heart disease, or older, and symptoms, and if they have difficulties with breathing or more significant symptoms. If you're generally younger and you have symptoms, it could be the COVID virus, but your doctor may not recommend testing. The truth is that from a clinical standpoint, with treating this virus and managing it, it's not very helpful to know if you have the virus. So the testing isn't that critical for us. We are testing more frequently people that have significant symptoms or high risk. Okay. So one of the things that I am grateful for is my family. I have 2 sons. One's a freshman at Michigan State University. The other one is a sophomore at Eisenhower. Initially, they thought it would be nice to not be in school. I think they now wish they were back in school. And I have a lovely wife, Julie, and we're going to be coming up on our 25th year anniversary. And I'm grateful for my family. This is a sacrifice for them with me living out here in the camper. It's a sacrifice for me. But I think they have grown accustomed to sharing their father or their husband with my patients, and I'm always grateful for them and their understanding. And this is going to be very difficult for all of us, but it will pass, and we will come back together hopefully sooner than later. But this is day 1, March 23rd. And we'll be doing a video like this each night as I'm here confined in the cabin. One thing that I'm good thing that I'm hoping that comes out of this crisis is I hope that we see more civility in our society, more unity in our society. This virus doesn't discriminate. It doesn't care if you're Republican or Democrat. It doesn't care what your race is. It doesn't care what your citizenship is. It has no borders. It doesn't care what your sexual orientation is. And I'm hoping that because of that we'll see more unity in the United States and more unity in the world in general as we all come together as a human race to fight this common enemy. Finally, one thing that I like about direct primary care. First of all, what is direct primary care? Well, direct primary care is a type of practice where we've been practicing for 20 years, where we don't bill insurance. Our patients pay a monthly membership fee, and for that we're able to give them more access to us, and we're able to provide more care, more time with them, and give them hopefully a better experience of care, better outcomes of care, and reduce the overall cost of care as well. People pay a monthly membership fee for that. It's $90 per patient per month, and basically it hires you a private physician or physician assistant. If you want to learn more about direct primary care, you can find us on facebook.com/SALTA of Troy or facebook.com/SALTA of Clarkston Direct Primary Care, or see our website at www.saltadirect.com. I want everyone to be safe out there, love each other, and take care of each other, watch out for each other, and hopefully while we're confined at home, come together and get to know each other a little bit better, okay? And I'll be back here again tomorrow in day 2 of my confinement in the cabin. Thank you very much. Bye-bye.